Welcome. My name is Liz Stokes, and I am the Director of the American Nurses Association Center for Ethics and Human Rights. This short video will describe ANA position statement, the nurse's role in addressing discrimination, protecting and promoting inclusive strategies in practice settings, policy, and advocacy. Doctors Thomas Ray Coe and Michelle Upvall contributed to this position statement and educational video on behalf of the ANA Ethics Advisory Board. The purpose of this position statement is to reiterate the significance of a non-discriminatory stance and provide guidance in creating inclusive strategies for nursing care of all individuals, of all ages, and from all populations. ANA recognizes that discrimination in any form is harmful to society and is against the values and code of the nursing profession. Discrimination has no place in nursing practice, education, or research. Progress to eliminate discrimination through improving access to and attainment of healthcare and quality of healthcare is ongoing and efforts must continue. All patients should equally be screened for all health risk factors. All patients are equal and should be treated with impartiality, respect, and civility. Demographic or socioeconomic status should not influence the level of care provided. Nurses must recognize the potential impact of unconscious bias and practices contributing to discrimination. Nurses must actively seek opportunities to promote inclusion of all people in the provision of quality health care while eradicating disparities. Policy initiatives directed toward abolishing all forms of discrimination is essential in nursing practice. What is discrimination? Discrimination exists when a person is treated unfavorably or unjustly according to a particular characteristic such as race, age, gender, or religion. There are many other characteristics for which discrimination can occur. For example, discrimination can occur on the basis of pregnancy, political affiliation, or military status. The list goes on and may change over time. It also includes family medical history and genetic testing that can be used as a basis for discrimination. Attitudes and beliefs about personal characteristics in the forms of bias, prejudice, and stereotyping may influence behavior, but the actual act of discrimination, also known as intentional or blatant discrimination, occurs when an individual or group acts upon those attitudes and beliefs. Discrimination may be manifested as microaggressions in the form of a microassault. Implicit or unintentional discrimination can be as detrimental as intentional discrimination. Manifestations of unintentional discrimination in the form of microaggressions are unconscious behaviors that are considered to be rude, demeaning, or damaging to the individual or group. These microaggressions are further classified as micro-insults and micro-invalidations that disavow the experiences or beliefs of a group. Organizational policy that inadvertently supports discrimination is in error. It does not matter if it is an organization's policy that discriminates or a policy in support of individual employees who discriminate. It is wrong and must be stopped. Progress to eliminate discrimination through improving access to and attainment of healthcare and quality of healthcare is ongoing and efforts must continue. Intentional or blatant discriminatory practices must not be tolerated and must be immediately addressed. Nurses must engage in a period of self-reflection regarding their personal and professional values regarding civility, mutual respect, and inclusiveness, and resolve any potential conflicts in ways that ensure patient safety and promote the best interest of the patient. Nurses must seek out and support nursing practice environments that embrace inclusive strategies and promote civility and mutual respect regarding patients, co-workers, and members of the community. Nurses must advocate for policies that are inclusive and promote civility and human rights for all healthcare workers, patients, and others within the organization and community. Nurses must encourage all healthcare agencies to adopt and aggressively maintain policies, procedures, and practices that embrace inclusiveness, promote civility and mutual respect, and contain methods for reporting violations. Nurses in all environments and at all levels must embrace the concepts of justice, caring, diversity, and inclusiveness, and civility and mutual respect as guiding principles within the provision of healthcare. Nurse researchers must support and conduct research that is inclusive in nature, including diverse populations and their healthcare needs. Nurse managers, supervisors, and administrators must assess policies to ensure support of inclusiveness, civility, and mutual respect, acknowledging that the lack of such policies may result in environments that fail to sustain high quality, effective, efficient, and safe healthcare practices. Nurse educators must promote a diverse workforce by developing education practices to attract and retain students from all backgrounds. An increased number of diverse nurses in the workforce will begin to reflect the diversity of the overall population in the United States. Nurses must embrace a patient-centered approach and response to the individual care needs of all patients. Let's look at a case study. Justin is a 27-year-old female-to-male transgender patient who presents to the emergency department on a Saturday night at 9 p.m. with severe right lower quadrant pain. During the intake assessment, Margaret asks if Justin has ever felt pain like this before. Justin responds, disclosing his gender history, and states, "I think it might be my ovary." Margaret, the nurse, stops the assessment and says, "This is probably your body's way of telling you that you shouldn't be doing what you're doing. God doesn't make mistakes. I don't think there's anything we can do for you," and gets up to leave. When Justin asks to see a provider and mentions he has an ultrasound in the past, Margaret tells him, "There's no one here to do an ultrasound at this hour. Besides, we don't do sex changes here." The nurse, Margaret, tells Justin he should just call his regular provider on Monday morning and that she will call security if he does not leave right now. Here are some questions for your reflection. Should Margaret have completed the initial assessment? Why? What are the potential consequences of transphobic comments and attitudes? How should Margaret's supervisor respond to Margaret's behavior? Please take a moment to pause this video and reflect on these questions. Discriminatory practices that are either intentional or unintentional must be addressed by individual nurses and the profession as a whole. All nurses must examine their biases and prejudices for indications of discriminatory actions. Health disparities are influenced by health policies, individual discriminatory actions, marginalization, and perceived discrimination by the affected population. The nursing profession is responsible for promoting an environment of inclusiveness where all people receive safe, quality care, and caregivers are intolerant of any discriminatory practice. Thank you for watching this educational video. Find the full statement on nursingworld.org/ethics or contact us at ethics@ana.org.